Today in this video we are going to discuss about the coronary circulation. Coronary circulation is important circulation because it is supplies to the heart. Heart is pumping the blood to the whole body, but heart receives the blood supply from the coronary circulation. If the coronary circulation is stopped more than 1 minute, it will produce the stoppage of the heart. So it is the key circulation, important circulation. So coronary circulation is the important short notes in the cardiovascular system. We will briefly discuss about the coronary circulation. Blood supply of the heart. The heart is supplied by the left coronary artery. This is the left coronary artery in this image. Left coronary artery supplies to the left atrium and left ventricle. This is the right coronary artery. It is supplies to the right atrium and right ventricle. This is the right coronary artery. The right marginal artery is the branch of the right coronary artery. Posterior interventricular artery. These are the branch of the right coronary artery. Left circumflex artery and anterior interventricular artery. These are the branch of the left coronary artery. Both the left and right coronary artery arise from the base of the aorta. Base of the aorta behind the aortic cusps of the semilunar valves. Physiologically, it has no anastomosis between the left and right coronary arteries. These are functionally end arteries. So this is the functionally end arteries. So the blockage of the particular end portion, it will affect the particular area of the heart. And the cusp, the sinus valsalva is the outposting of the aortic valve cusps. So that place the coronary arteries are originated. So that place produces the eddy currents. It keeps the valves moves away from the wall of the arteries. So it will use the blood supply during systole also. So this is important for the receiving the heart during the systole and diastole. Heart receives the more blood supply during the diastole compared to the systole, but systole also it will receive some amount of the blood. Venous supply of the heart. Heart has the various venous supply. The major system is the coronary, sinus and anterior cardiac vein drain into the right atrium. The minor systems are arteriosinusoidal vessels and Debesian veins, arterioluminal vessels directly enter into the cardiac chamber. Innervation of the coronary blood vessels. It is supplied by the sympathetic nervous system. The coronary blood vessels has the more number of the beta receptors, so it produces the vasodilatation. Stimulation of the sympathetic nervous system produces the vasodilatation through beta receptors. Parasympathetic stimulation also produces the vasodilatation due to the act via the cholinergic receptors. Special features of coronary circulation. Heart receives the more blood supply during the diastole. During the systole, the ventricular compression is more, especially in the left ventricle. So that time the blood flow to the heart is decreased through the coronary circulation compared to the diastole. So more blood supply is received from during the diastole, especially during the endocardial region receives the less blood supply during the systole. So the subendocardium is more prone to the ischemia and infarction. Ischemia means reduced blood supply to the particular area of the heart. Infarction means permanent loss of blood supply to the particular region. So the coronary arteries are functionally end arteries. So the lesion in the particular area of the arteries affect that region of the heart. Okay, lesion in the particular vessels affect the particular regions of, suppose especially if the lesion in the left coronary artery means it only affect the left ventricle and left atrium. Okay, and metabolic regulation is very well developed in the coronary arteries. It can meet the demand of the activities. So it during the exercise and during the activities it needs more oxygen. That time the coronary blood supply is 4 to 5 times increases to meet the demand of the oxygen. No anastomosis between the right and left coronary arteries physiologically. So already we explained, during the exercise the coronary blood supply is 4 to 5 times increased. So that will meet the demand of the oxygen during the exercise. Okay. The main fuel of the coronary circulation heart is the fatty acids. 1/3 of the fuel is the fatty acids. Other fuels are glucose, pyruvate, lactic acids, amino acids. These are the other fuel. Major fuel is the free fatty acids. 1/3 of the fuel is the free fatty acids. So heart receives the more oxygen extraction. 80% of the oxygen extraction from the arterial blood supply. During the rest also arteriovenous oxygen differences is very high. So it receives the more oxygen from the coronary circulation. The normal weight of the heart is around 300 grams. It receives the 250 ml per minute. It receives the blood supply average amount is 250 ml per minute. So it is, otherwise we can express as it can receive 85 ml per 100 gram of cardiac tissue per minute. 85 ml per 100 gram of cardiac tissue per minute. So it is the second organ receives the more blood supply. First organ is the kidney. Okay. So it has a high oxygen consumption. It is 9.2 ml per 100 gram of tissue per minute. Measurement of coronary blood flow by direct method. Direct method is done in the experimental animals during the cardiac surgery by fixing the electronic flow meter, assess the coronary circulation. And indirect method we use the Pick's principle. We give the known amount of the indicators like inert gases, nitrous oxide, and we have to measure the arterial venous concentration from the connecting from the arteries and the coronary sinus, and we can measure the coronary blood flow by the average concentration of the inert gas nitric oxide in the arterial blood divided by the arteriovenous difference and the arteriovenous differentiation of the nitrous oxide. It can give the normal value of the coronary blood flow. And we can use the radioactive substance thallium 201, xenon 133. We have to fix the gamma camera in the chest area. We can assess the coronary circulation. Regulation of the coronary blood flow, the neural regulation. The sympathetic nervous system stimulation produces the vasodilatation because of the coronary blood vessels contains more number of the beta receptors. The parasympathetic stimulation also produces the vasodilatation because it acts through the cholinergic receptors. Both sympathetic and parasympathetic increases the coronary blood flow. The metabolic regulation is well developed. During the any increased activities, the metabolic regulation is activated. It increases the blood supply. Mainly in the hypoxia, increase carbon dioxide concentration, increase potassium level, increase hydrogen ion concentration, increase produces the vasodilatation. It acts through the mainly hypoxia, it acts through the adenosine. Adenosine plays the important role. It is in the key substance in the reactive hyperemia. So after the occlusion, it increases the blood flow due to the production of the adenosine from the ATP. It increases the vasodilatation. Autoregulation is maintain the mean arterial pressure from the 70 mm mercury to 110 mm mercury. The myocardial tension is the important physical factor to maintain the coronary blood flow. So during the systole, the tension is more, intraventricular tension is more, ventricular contraction is more, so it decreases the blood flow. During the diastole, it receives the more blood supply. So the next slide we will show the one graph pattern. It will depict clearly. This graph, the x-axis depicts the duration of the systole and the diastole. The y-axis the coronary blood flow. During the systole, the coronary blood flow through the left coronary artery and right coronary artery. Left coronary artery is the predominant artery blood supply to the heart. So during the systole is comparatively very less. During the diastole is blood flow through the left coronary artery is very high compared to the right coronary artery. The systole is blood flow is very high less due to the myocardial tension. During the ventricular systole is very high, so it will reduces the blood supply during the systole. Clinical aspects. Coronary artery disease is due to the reduced blood supply to the heart. When the blood supply to the heart is reduced temporarily, means it is myocardial ischemia. It is permanently reduced blood supply to the heart is called as the myocardial infarction, otherwise called as the heart attack. The myocardial ischemia, myocardial infarction occurs due to the formation of the atherosclerosis within the blood vessels. That is deposition of the fat within the blood vessels. That is aggravated by the physical inactivity, obesity, smoking, hyperlipids level. These are the factors provoking the coronary artery diseases. Angina means chest pain. Angina pectoris is mainly occur in the myocardial ischemia. So the severe chest pain occur in the angina pectoris. It is radiating to the left hand in the ulnar border of the left hand and jaw with excessive sweating. This is the angina pectoris. It is mainly due to the releases of the substance P produces the pain during the ischemia and infarction. In the ECG changes in the myocardial ischemia, ST segment is elevated. So see this in this normal ECG, the ST segment is the isoelectric line. See, in the myocardial infarction, the ST segment is elevated. This is the differentiating point between the normal ECG and myocardial infarction. So immediately we can save the patients. If you treat the patients within the time, the crucial time, the life-saving time is the half an hour to 1 hour. So if you lyse the clot within the coronary vessels, means we can save the most of the patients. So you should know the changes in the myocardial infarction is the ST segment elevation. You should not forget. The myocardial ischemia, mostly it produces a T-wave inversion. The cardiac enzymes are also elevated, especially creatinine kinase, CKMP, that commonly tell us CKMP, and LDH, lactate dehydrogenase, LDH 1 fraction, also elevated in the coronary artery diseases. For the detail of the coronary obstructions, we can assess by the coronary angiography. We can do the coronary angiography. We can know about the details of the coronary artery blockage. Treatment of coronary artery diseases. The myocardial ischemia infarction, first we have to give the rest and we have to give the oxygen supply. That is very, very important. Okay, in the textbooks not mentioned. We have to keep the patient in the rest and calm condition, and we have to give the oxygen, nasal oxygen supply, and we have to give the drugs like vasodilators. It will dilate the blood vessels, increases the coronary blood flow, especially nitrates we have to give. And streptokinase, immediately we have to give the streptokinase. It lyse the clot within the coronary blood vessels, especially in the myocardial infarction. It converts the plasminogen to plasmin. So immediately we have to give the streptokinase. Nowadays we use the tissue plasminogen activator, that is also used. This is a recently used drugs, tissue plasminogen activator. It is little bit costlier than streptokinase. Coronary angioplasty. During the coronary angiography, we can insert a catheter, we can remove the clot obstruction, that is coronary angioplasty. And calcium channel blockers like verapamil, it produces the vasodilatation, increases the coronary blood flow. Antiplatelet aggregation agents, especially aspirin and clopidogrel, that inhibit the cyclooxygenase pathway and prevent the thromboxane A2 formation. So it helpful to the prevent the myocardial infarction and ischemia. And folic acid and vitamin B12 is helpful because the hyperhomocysteine level produces the myocardial infarction. This folic acid, vitamin B12 convert the homocysteine to methionine, so it will prevent the hyperhomocysteine level. These are the different treatment modalities of the coronary artery disease. And finally, surgery. Coronary artery bypass graft, nowadays commonly doing in the higher cardiac centers. Coronary artery bypass graft, that will remove the obstructive area by bypass circulation. Okay. Summary of coronary circulation. Coronary circulation is important because it supplies to the heart, especially through the left coronary artery and right coronary artery. It supplies blood to the 250 ml per minute or 50 to 50 ml per 100 gram per minute. It has a high oxygen extraction from the blood to the heart. So it is regulated by the nervous system, especially sympathetic, parasympathetic, and auto-regulation stimulated by the hypoxia, hypercapnia, acidosis. It is mediated through the adenosine, and reduced blood supply produces the myocardial infarction. Permanently reduced supply produces the myocardial infarction. Temporary reduced blood supply produces the myocardial ischemia. And the treatment is, we have to give the nitrates and calcium channel blockers, streptokinase, tissue plasminogen activators, and coronary artery bypass graft. These are the different treatment modalities. Thank you for watching this video. Those who are not subscribed to the channel, please subscribe. Thank you once again.